What is bending the cost curve? When people talk about bending the curve or the cost curve, they're talking about the rising cost of healthcare. And at this point in America, the cost of healthcare is growing at such a rate that we're just not able to sustain it. It's been going like this for a while, but when we look into the future, it's rising at such a level that the economy will be devastated if it keeps going at the same rate. So when we talk about bending the cost curve, they're talking about looking at the rising growth of healthcare and just bringing it down, having it not grow as much, so it in effect bends the cost curve. What can we do to bend the curve? There's actually quite a few things that we can do to bend the cost curve or just to decrease cost in healthcare. The first is looking at minimizing the waste. Right now we have an enormous amount of waste in the healthcare system. In fact, there are estimates that $700 billion worth of the care that is being delivered has never been documented to help people get better. So there's a lot of things that we can look at in the system of what we're spending the money on and try to make sure that those things actually help get patients better. The second thing we have to do is we have to look at offering care that's more efficient, care that actually costs less, while we improve outcomes. And that might sound like something that's almost impossible to do, but it's not. Take, for example, someone that has asthma. If we do a better job taking care of someone with asthma in the doctor's office, seeing the same person, being able to talk to them about what's happening with their disease, we can pretty much predict that we will decrease the amount of times they have to go to an emergency room. So that increases the outcomes while we decrease the cost of extra emergency room visits. How can health reform legislation help? There's quite a few things that we can do in the healthcare reform legislation that's going through Congress now. The most important thing that we should do is change the way we pay for healthcare. Right now, we pay for individual tests, individual service. Every time someone goes to see a doctor, they get the doctor gets a reimbursement for it. Instead, what we need to do is tie that reimbursement to someone getting better. And that might mean that you spend more time talking to the provider. It might mean more time talking to a nurse about negotiating a complicated healthcare system and less time just running to get individual tests. And there's a couple things in the legislation that's going through that will change the way we pay for healthcare and do a better job incentivizing the coordination of care and looking at the patient's outcomes and making sure that they're getting better instead of just doing more tests. In healthcare, many, many times, more is not always better. The second thing we can do is better use of providers that are more efficient providers. And for example, primary care providers. Right now, our doctors and nurse practitioners that are providing primary care don't make anywhere near as much money as the specialist. And we know that if you spend more time going to a primary care doctor for many chronic diseases like diabetes and asthma, that we can decrease hospitalization. So the healthcare reform legislation will be paying more for primary care providers. And the last thing that the healthcare reform legislation can do is use better use of health information technology. And that'll help keep track of patients as they go through the complicated system. It will also help prevent things like duplicate lab tests and x-rays. You get the same lab test sometimes when you go to every doctor. And instead of all of that can be collected and we can track it in a way, we can also track better outcomes. And after all, the whole point of this is just having people be healthier at the end of their visit to a healthcare provider.